Now, as the African continent continues to face the challenge of accessing COVID-19 vaccines, health authorities are advising everyone to control and change behaviors that put them and others in danger. We have the details with Martina Abera.
Some of the residents who received COVID-19 vaccines say it has helped them improve their immune system, while others are also waiting to be vaccinated. They called and vaccinated me, and I know that even if I get infected with COVID-19, I will not get very ill.
Every time I hear on radio that many people got infected and others have died. As much as I've been vaccinated, I have to protect myself. Our wish is to be vaccinated so that our body immunity can increase.
In our village, we haven't been told anything about getting vaccinated. We haven't been registered either. As of the 4th of July 2021, 391,954 people have already been vaccinated, according to the Ministry of Health. President Paul Kagame says there is hope of getting more vaccines in the near future.
Muri iyi minsi tugiye kubona izindi nkingo zidufasha kongera ubwirinzi bw'umubiri duhereye ku barusha abandi ibyago byo kwandura COVID. Turifuza nuko zigera ku banyarwanda benshi uko bizagenda bishoboka. Ariko mu rwego rwo kwigira turakora ibishoboka byose ngo twubake ubushobozi bwo gukora inkingo n'indi miti mu Rwanda. Ibi bizagabanya guhora twiringiye imiti ituruka hanze y'igihugu itabonekera igihe cyangwa itangwa hagendewe ku zindi nyungu.
According to the World Health Organization, the number of COVID-19 infections on the African continent has risen sharply for the past 6 weeks, and that the mutated Delta COVID-19 has reached 16 countries on the continent. Strive Masiyiwa, the special envoy and coordinator of the African Union's COVID-19 vaccine acquisition task team, says the continent continues to face challenges in acquiring COVID-19 vaccines.
We've got an extraordinary situation with the third wave. We have struggled to get vaccines because we did not have our own production facilities. It doesn't matter what global structures people constructed, the countries, and there are still massive restrictions.
Strive Masiyiwa also says that some of the countries that have agreed to contribute to the COVAX program of helping the continent to get vaccines have not yet provided their contributions. Due to the problem, out of 700 million vaccines that were anticipated to be given to different African countries by the end of this year, only less than 50 million have been availed. Some residents say that while the vaccines haven't been given to everyone, people should follow guidelines in place to fight the spread of the COVID-19 pandemic.
The failure to follow safety measures is putting ourselves in more danger. Spreading the virus means that the country loses a lot, and a lot of people can die.
We should wear our face masks correctly, observe social distancing, and that has to be for everyone. We can get out of this situation by following measures in place. While vaccines continue to be a problem on the African continent, the number of COVID-19 infections has risen by 31% in the last week, according to the World Health Organization. The number of people under critical conditions has risen by 50% compared to the time of the first wave of the pandemic. According to the agency, 15 million people in Africa have already received the required doses of COVID-19 vaccine, representing 1.2% of the total population on the continent. Martina Abera, RTV News.